Hi, I'm Dr. Lisa Airan, and I'm an aesthetic dermatologist in New York City. And today I wanted to talk to you about Sculptra. Sculptra is a poly-L-lactic acid bead that we put underneath the skin, and then that bead resides in the skin for about 6 months. It stimulates the body to produce elastin and collagen in response to the injections. After 6 months, the bead goes away completely, and then what you're left with is your own tissue. So this is how Sculptra comes. It comes in vials. It's not resuspended, so there's tiny beads in the bottom. Whenever I see a patient, what I do is first analyze them to see which areas could use some volume to make them look as naturally good as possible. After I've evaluated the patient, I then mark them and give them small little areas of anesthetic so that they're really comfortable during the injections. Once the anesthetic has taken place, I'm able to inject through the areas with the needle with the Sculptra and then put it into those areas where I would like to see change. Janet's already had 2 treatments with Sculptra, so she already looks fantastic. But this third treatment is kind of like completing the golf swing, and the areas that we've marked, adding a little bit more volume in those areas is gonna make a huge difference in how she looks. You can see the change right away with Sculptra, but it doesn't last. After 3 days, it goes away completely, and all that's left is the bead underneath the skin, the poly-L-lactic acid bead. And that bead stimulates her own body to produce elastin and collagen in response to the bead. After 4 to 6 weeks, the body has responded to the bead, and then the tissue that she's left with is her own tissue. So we do see the patients back at 4 to 6 weeks, and if they need another vial of Sculptra, we give them the Sculptra at that time. We continue this process until we have achieved the final result that we're looking for, which is usually after 2 to 3 vials. And then those results last for 2.5 to 3 years. I'm just doing her massage, which she'll need to do herself 5 times a day for 5 minutes for 5 days after this. You could see that she's got a little bit of change, which is just related to the volume that I've put into the tissue. That will go away after 2 to 3 days, and then 4 to 6 weeks later, she'll be left with her final result. If you're interested in seeing other videos, including Janet's full transformation, please tune into my YouTube channel and take a look.